Hi, and welcome to Ostomy Care with Angel Face Amy. Have you ever had open, weeping, broken skin around your stoma and no appliance is sticking and you have to just keep changing it? Have you been so frustrated and you're not sure what to do? Well, I'm going to answer this question in today's episode, and I'm going to teach you all about the skin crusting technique. Hi, everyone, and welcome to Ostomy Care with Angel Face Amy. I'm Amy, and I'm so excited to start this journey with you. I named this channel in honor of a special patient from when I was just 16 years old and working as a CNA at a local nursing home. When I used to get her ready for bed and put her in bed, she would hold my face in her hands and call me Angel Face, and that's where my nursing career really began. Now, as a wounded ostomy nurse, I want to share my knowledge that I've gained over the years to help you live your best life with an ostomy. I know how overwhelming it can be to navigate life with an ostomy. Whether it's new to you or something that you've had for years, my goal is to give you practical tips, tricks, and education to help you feel more confident in your care. This channel is a place where we can build a community to support each other along the way. In future videos, we'll cover everything from how to apply your ostomy appliance to preventing leaks and taking care of the skin around your stoma. I'll also share product reviews, common troubleshooting tips, and answer all of your questions from the comments. As a certified wound and ostomy nurse with many years of experience, I've helped countless patients through their ostomy journey. I want to bring that same care and compassion to this channel. I realize as an ostomy nurse that this is lacking, that there's not very much extra support for you when you're dealing with something so life-altering. And I wanted to give you another resource to help you as you navigate this new diagnosis and this new problem. I just want you to know that you're getting advice from someone who truly understands what you're going through and cares and wants to help. Today, I want to share one of my favorite techniques for dealing with irritated, red, broken skin around the stoma. It's called the skin crusting technique. This can help when the skin becomes irritated from leaks or moisture. And this is really the best thing to try first, is you cannot use any creams or ointments because they would hinder any appliance from adhering to the skin. So the steps to this technique are to first start with clean, dry skin around the stoma. Next, you're going to apply a thin layer of the powder to your skin. And if you see redness or anything like that, make sure you sprinkle it all in that area. And then you're going to gently dab off the excess powder. And then you're going to seal the powder in by lightly applying a skin prep barrier wipe. And then you're going to let it dry completely. And then you'll repeat the process if needed. You'll do the powder, dab, and then the skin prep. And you'll do this until the area is dry and protected. And then you'll apply your ostomy barrier as usual. Now I'm going to kind of show you on my hand what I mean by this process. So on my hand, I have this fake little stoma here. I know this does not look very realistic, but I wanted to at least give you a demonstration of what this technique is. So this is a stoma powder. This one is made by Coloplast. And what this powder is actually powder form of this inner part of a barrier, which is called a hydrocolloid. So this actually helps your skin heal. If there's issues or problems, this is very good at helping irritated skin heal. So they made this into a powder, and that's what stoma powder is. So the first step to this is make sure that the skin is all clean and dry around the stoma. You're going to just clean it with your warm water as usual. And then you're going to take the stoma powder and you're going to sprinkle it all around your stoma. And it's fine if you get it on the stoma. It won't hurt the stoma. So once you sprinkled it all around, it's going to stick to wherever the skin is broken or irritated or weeping. So you're going to brush off the excess powder. You just want to go around your stoma and brush it off. Then you're going to take skin prep or skin protectant or skin barrier film. All of these are the same thing. They're just different applications and different brands. So this is a skin protectant. It's called No Sting Barrier Film. It's made by Cavalon. And this one is on a stick. So this is actually one of my favorite ones just because it's easier to apply this over this powder around the stoma. And these have a lot of liquid in them, so they are really easy. So you're going to dab this around the stoma over that powder. This is going to seal the powder in. Then you're going to let that dry. And then if you still feel like there's some weeping going through or you think it's still irritated, not quite covered, you're going to do the process again. So you're going to sprinkle the powder around the stoma. And then you're going to brush off the excess powder. and it'll just stick where it needs to. And then you're going to seal it in again with the skin protectant. So you're going to make sure you get a good skin crust built up where your new appliance would stick. So that's the skin crusting technique. Now I have this layer built up around my stoma that would be, when I applied the new barrier, it would stick better. If I had broken, irritated skin, it would stick it and it would help that skin heal. The other reason why it helps it heal is because now after 3 days, when you go to change your barrier and you take it off and you rip it off, instead of pulling off the newly healed skin, you're actually going to be pulling off this crusting technique. You're going to pull that layer of the skin crusting off, and then underneath it, the skin will have healed. So I can kind of demonstrate that a little bit here. I have a piece of tape. So I'm going to show you that if I stick the tape on, and you can imagine if it was really your barrier, it's a lot stronger adhesive, but when I take this tape off, it's going to pull off all that skin crusting that we just did and not hurt my skin at all. So we just pull that off. And I don't know if you can see there's actually a line where I can tell that this tape just pulled off all that crusting technique and it wouldn't have pulled off my newly healed skin. So that's just a demonstration of what I mean by a skin crusting technique. And hopefully that would be something that you could do to help if you ever had irritated skin around your stoma. I do get some questions when I explain this to patients. One of the questions that I get is, how often can I use this technique? And the answer is that it's safe to use this every time you change your appliance if you needed to. But like I said earlier, the manufacturers say that their barriers work best when they're directly against the skin. So the more layers of stuff you have on your skin under the barrier, you're just kind of hindering this from doing its job. So you want to try to only use the barrier against your skin, but if you have broken or irritated or a rash, anything like that, then you would use this technique as long as you need to until it gets better, and then you would stop doing it. Another question I get is, will this affect how my barrier sticks? And the answer is, this would actually help if your skin was all broken and irritated and weeping and wet. I mean, when that happens, the appliance is not going to stick very well at all because of the weeping and the sore skin. So this would seal that all in and allow the barrier to stick better by creating a dry surface for it to adhere to. Just make sure you always do the skin prep last. You don't want to do the powder as your last step because that would not stick well. So it has to be the powder, then the skin prep. And then the last question that I often get is, what if the redness, or if it's a rash, what if it doesn't get better? What if it doesn't go away? And one thing I will say about that is that there is a chance, because of moisture and being trapped under the barrier, you could have developed a fungal infection. And in that case, we would recommend that instead of using the stoma powder, you would use antifungal powder, which is sold over the counter for like athlete's foot and things like that. You would use antifungal powder rather than the stoma powder, but do it the same exact way with the skin prep, and that would treat the fungal infection and it would build up that surface for this to stick to. You would only do this if your ostomy care nurse, or if it itches, if they really think you have a fungal rash, that's what you would do. But my answer to that question is, if it doesn't get better, you should probably call your ostomy nurse or your provider and let them take a look at it and suggest what should be done. So that's really it for the skin crusting technique. If you have any questions, be sure to put them in the comments. You're not alone in this journey. There are many people who have this, and there's lots of tips and tricks that I hope I can teach you to help make it easier. My hope is that this channel will be a place where we can learn together. And if you have any questions or topics that you'd like me to cover for future videos, please leave them in a comment below. I'd love to create future videos based on your questions. Hearing your stories, challenges, and victories will help others feel supported too. My goal is not just to help you manage your ostomy, but to help you thrive. I believe that with the right knowledge and support, you can live a happy, full life. Thank you so much for watching Ostomy Care with Angelface Amy. Don't forget to subscribe and hit that notification bell so you don't miss any new videos. Remember, you can live your best life with an ostomy, and I'm here to help you every step of the way. Thank you so much for joining Ostomy Care with Angel Face Amy. Please remember to submit your questions and comments in the comment section below. And remember, you are more than your ostomy. You are strong, resilient, and capable. Let's navigate this journey together.